Early intervention for children's mental health is so crucial because when we ignore something, it doesn't just go away, it gets worse. And one thing that I've noticed with a lot of my patients is the ripple effect of someone's mental health issue on the entire family. It affects families' morning routine. It affects their ability to interact and connect with other families. It affects family activities together. Everyone in the family can be walking on eggshells around that person that's struggling with their mental health issue. Without the mental health issue being addressed head on, children could use unhealthy coping mechanisms such as turning to drugs, alcohol, or more risk-taking behaviors. Some potential benefits from early intervention with children's mental health is the longer a child goes without feeling heard or seen, the more confidence he or she loses. The less interest that child will have in school or outside activities that could bring them connection or joy. The earlier we intervene, whether it be through medication, a special school plan, or therapy, the less likely that child will be to fall behind and lose that confidence. I often tell my patients of all ages that we have to do things afraid. We can't wait till we're ready. When a mental health issue goes untreated, children lose that confidence to take those positive risks that could give them some joy, connection, and an improved life. Specific mental health conditions that could benefit from early intervention in children are ADHD, depression, and anxiety. For example, with ADHD, intervening early may mean medication, it may not. You can work with therapy to learn specific behaviors. They have behavioral therapists at school. A special school plan can be designed so you can spend more time with the teacher and have them explain it in different ways. Our goal is to keep the child in their grade and to prevent them from losing confidence. And one issue as well with depression and anxiety is the isolation. For me, intervening means bringing feelings out into the open. And I once heard a therapist say, what's mentionable is manageable. So what we can talk about and verbalize to a safe person, we can cope with. Parents can advocate for their children's needs by using their voice to connect with their pediatrician, the teacher, guidance counselors, school psychologists. There's lots of resources. One of the biggest things I recommend for parents is taking a pause before writing any email or picking up the phone to call any teacher, any school official. When our children's mental health is compromised or if they're struggling, it always triggers something in us as parents. Sometimes it helps to have that pause and just get curious about what's going on as opposed to judgmental. And so we can find the root cause of it. There are plenty of resources available to parents who want to help their children with their mental health. I think at times it feels like there isn't, but I recommend starting with your pediatrician and asking them for resources. You can also talk to your teacher, the school guidance counselors, their school nurse is a great resource. And I also think there are plenty of online resources as well, Facebook mom groups, that might have some good suggestions. One of my absolute favorite parts of my job is seeing children because I see their ability to walk through difficult things, learn skills, and sometimes outgrow some of these disorders. I would say some of the common ages kids come in for early intervention would be like first or second grade sometimes, because that's when it's really getting like you have to sit in your seat, you have to pay attention, there are tasks that you have to complete. I also see a lot of patients about a middle school when things get a little bit more difficult socially and kids feel a different kind of pressure, not only from school, but with peers as well. Another thing that I feel so strongly about is parents taking care of their own mental health. That you don't just drop your child off at the therapist's office and expect them to be fixed. It's a family effort, it's a parent effort. And not only do you want to do it as an example to your child, but we cannot we have to fully charge our battery. We cannot go run on empty and expect to be parents that are able to help our children.